Hi, I'm Dr. David Thomas. I'm a practicing psychotherapist with the Whitford Thomas Group in Tampa, Florida, here to discuss how to take a self-test for eating disorders. When we think of eating disorders, at least I think of two basic eating disorders. You have anorexia, which where one starves themselves, probably the more famous anorexic that I'm familiar with is Karen Carpenter. And there's another young lady who used to work with or star with Paris Hilton in some sitcom, unfortunately. Lionel Richie's daughter, don't know her first name, can't remember her first name, but she's another one that we've kind of noticed in the media. So this anorexic is one type of eating disorder. The other eating disorder is bulimia, and that's where oftentimes individuals will eat an excessive amount of food, and then purge it, then go to the bathroom or the restroom and throw it up. So those are the two basic types of eating, major types of eating disorders. So what's a self-test? I'm not really sure as far as a self-test, but I think more than anything else, people around you begin to notice either the weight loss or the tendency to eat very large volumes of food and then leave the area fairly quickly to purge it. So as far as a self-test, I think oftentimes your first self-test is really noticed by other people. Other self-tests is that if you tend to become very moody based upon your appearance, your own self-image, that you tend to have some equation such as the only way that I can be accepted or loved by others is that if I look a certain way, oftentimes it's kind of perfect shape. What other self-help tests you can begin to use regarding eating disorders? I think if you find yourself losing a significant amount of pounds, that becoming almost obsessed with the idea of eating or not eating are probably pretty good indicators regarding eating disorder as well. Eating disorders is really a disorder related to your own self-acceptance. It's not about your looks, it's not about your weight, it's about your own ability to accept yourself. And I think that's the area when you're talking about eating disorders you want to be most concerned about. If you have some questions, make an appointment with a therapist. My preference is a cognitive behavior therapist, but certainly go talk to somebody about that. Hope this information has been helpful. From Tampa, Florida, I'm Dr. David Thomas.